Good morning, and thank you for joining us for our latest media briefing on the important healthcare issues in the news. My name is Dr. Andrew Park, and I'm the president of the Ontario Medical Association, which represents more than 43,000 physicians. The World Health Organization has identified climate change as this century's single biggest health threat. We are experiencing it firsthand this summer, where the record-breaking wildfire season in Northern Ontario has blanketed major cities in smoke, causing health problems for millions of people in Canada and the United States. Wildfire smoke is a form of air pollution that can irritate your eyes and respiratory system, reduce your lung function, and worsen chronic heart and lung diseases. Wildfire and other climate-related issues, such as flooding, can also have an impact on our mental health. It's not unusual to feel anxious, stressed out, sad, or isolated during these events. In other signs of climate change, earlier this month, the Earth registered its 3 hottest days on record. According to federal government data, the number of extremely hot days in a year is expected to more than double in some parts of Canada over the next 30 years. These heat-related issues are a particular concern for low-income and vulnerable populations, many of whom lack access to air conditioning or cooling centers. In general, Indigenous, Black, and other marginalized communities are often hit the hardest by climate change, whether due to wildfires, rising sea levels, and receding shorelines on traditional territories, or flooding and heat domes in crowded urban centers. Furthermore, Ontario's Chief Medical Officer of Health warned there could be a growing number of cases of Lyme disease and other tick-borne illnesses. He said this was directly linked to climate change, as more ticks are able to survive Ontario's winters. As physicians, we know that a healthy planet or a healthy population requires a healthy planet. In the OMA's prescription for Ontario Doctor's 5-point plan for better healthcare, we call for immediate action to be taken on climate change to mitigate severe consequences on human health and well-being. We are also looking at our own industry. The healthcare system creates nearly 5% of Canada's greenhouse gas emissions. Ontario's Anesthesiologists, a section of the Ontario Medical Association, has developed a new position paper with recommendations. Today, we have a panel of physicians gathered to talk about the effects of climate change on our health. I'd now like to introduce my physician colleagues. Dr. Gili Adler Nevo is a co-chair of the OMA's Greenest Health Medical Interest Group and a psychiatrist at Michael Garron Hospital in Toronto. Dr. David Ohrling is chief of the Department of Anesthesiology at Collingwood General and Marine Hospital. Dr. Ohrling is a lead author of the Ontario Anesthesiologist position paper. I'm now going to hand things over to Dr. Adler Nevo to talk more about how patients are being affected by climate-related events and how we can expect this impact to grow in the future.
Thank you so much. And I think this is so important. I first wanted to talk about the wildfires. I think we've all been concerned worldwide regarding the current Canadian wildfires. I'm currently in beautiful Ontario, 2.5 hours north of Toronto, and I was told by people here that cars were covered in ashes just a couple of weeks ago. Even though the fires were hectares away. And in the meantime, the same wildfires, a friend in New York was calling me frantic because she didn't want to let her kids out of the house because of air quality, the same fires. And if you had a look in Google Maps, you could see that there are 2 new features. One is the air quality map, and the other is the wildfire map, as if it's always been there, as if it has to be this way. But we really don't think it has to be this way. The main health hazards relating to wildfires is particulate matter. It's called PM 2.5. These are tiny products of combustion that are so small that they can enter an aperture that is 2.5 micron wide. And this means that they can reach almost anywhere in the body through the bloodstream. So not only cause irritation to the lungs and exacerbate asthma, but also generalize inflammatory cascades that can trigger heart disease and other problems. 10 million people die each year worldwide from air pollution, which is also from combustion of particulate matter, this time the burning of fossil fuels. And in Canada in 2006, 1/3 of all particulate matter was due to forest fires. So you can only imagine what's happening in our air right now. Dr. Courtney Howard, who's the vice chair of the Global Health Alliance and past president of the Canadian Association of Physicians for the Environment, studied the effects of wildfire smoke in 2014. In Yellowknife, that's where she lives, they had 2.5 months of wildfires on and off and constant smoke over that summer. And in her study, she found a doubling of ER visits due to asthma, doubling over the course of that summer. And also people reported that they felt anxious and irritable, disconnected from the land and disconnected from their normal activities. The current wildfires and other extreme weather events are occurring higher and higher frequency. And this, as Dr. Park said, is all a consequence of climate change. The Lancet Countdown report depicts climate change as the biggest global health threat of the 21st century. Some additional hazards, like Dr. Park said, beyond forest fires and air quality of climate change are heat stress, which affects primarily the poor who live in areas with less greenery in the global south. There's a rise in allergies, a rise in infectious disease, like Dr. Park mentioned. In my work as a psychiatrist, I see the effects of climate change on mental health from several aspects. I'm a child psychiatrist who works primarily with children and teens who have been diagnosed with anxiety disorders, and most of my patients have a constant worry about the climate crisis. Beyond worry, they tell me that they grew up into a reality in which the climate change is a fact. And in their mind, they're bewildered and frustrated because they really don't understand how adults, us, are not doing anything about it. On the other hand, there are countless studies that show that nature alleviates anxiety, decreases depression, and even accelerates recovery from surgery. And this is the same nature that climate change is depleting. We became doctors because we care. We care about people. We care about the world we inhabit. And this is also what pushed my colleagues and I to do climate work. As physicians, we feel responsible because we understand some of the science, and we know that the evidence for the fact that the climate crisis is here and is anthropogenic, which means man-made, is robust. In fact, it's even more robust than some of our practices in medicine. The IPCC, which is the Intergovernmental Panel on Climate Change, is the leading international body for the assessment of climate change. And for the last report, 66,000 peer-reviewed articles were analyzed by 782 scientists from 195 countries. And beyond the conclusion that the climate crisis is unequivocally caused by human activity, the IPCC added, and I'm quoting here, "There is a rapidly closing window of opportunity to secure a livable and sustainable future for all with high confidence. This window is closing due to positive feedback loops, which are creating irreversible tipping points." A good analogy to where we stand within the climate crisis trajectory is malignancy. And I'd like to talk more about that, and I hope somebody will ask me about that later on. So we said it's important to act, and if we stay on the current path, a child born in Canada now will experience a Canada that is 6 degrees warmer by the time they are in their 60s, 6 degrees warmer. This is not something we can adapt to in a healthy way. We feel people and leaders are misinformed. No one would have been cynical enough not to act if they understood the science. And this is our role as physicians, beyond adaptation and mitigation, which is important, to provide information and prevention. Thank you so much.
Thank you, Dr. Adler Nevo, for your impassioned remarks. I'd like to hand things over to Dr. David Ohrling from Ontario's Anesthesiologists, who will be speaking to the healthcare industry's impact on climate change and how it can be minimized. Dr. Ohrling, what kind of pollution do hospitals cause, and how can this be curbed?
Thanks very much, Dr. Park, for the introduction, and I'm very pleased to be here representing Ontario's anesthesiologists. Appreciate everyone's interest in the very important topic. I'm going to focus mainly on greenhouse gas emissions from our hospitals, and in particular our operating rooms, where I work as an anesthesiologist, and with them I'm most familiar. Certainly there are a number of pollutants that are produced by our practices. Climate change is the biggest issue that we're facing and the one that we're talking about. So we'll focus mainly on greenhouse gas emissions. But what's already been made clear is that climate change is a healthcare issue and one that healthcare leaders have a responsibility to address. Our healthcare system in Canada, as mentioned, is responsible for approximately 5% of our total greenhouse gas emissions, which is more than the airline industry. We're contributing to the climate crisis. As mentioned, a healthy population requires a healthy planet, and we have to recognize this reality and act on it. Ontario's anesthesiologists, or the OA for short, is a section of the OMA, which represents almost 1,500 anesthesiologists in the province. Our membership is concerned about the environmental impact of the care we provide. The OA has formed an environmental sustainability working group, which has been focusing on two main projects recently. The first is the reduction of the impact of anesthetic gases, which are potent greenhouse gases. The second involves addressing the current practice in our operating rooms of relying on single-use medical devices and supplies, which is both wasteful and has negative environmental impacts. The changes we're advocating for will have positive effects on our planet's health and, by extension, patient health. They can improve the value of the care we provide without adversely affecting outcomes. Our initial focus has been on anesthetic gases, as mentioned, which are potent greenhouse gases. One of the anesthetic gases still routinely used in many hospitals is called desflurane, and it has a significantly larger carbon footprint and is also more expensive to use than other options. A growing list of hospitals across the province, as a result, have removed desflurane from their formularies, including Sudbury, Sunnybrook, the University Health Network, Kingston and its partner hospitals, and proudly my hospital, Collingwood General and Marine Hospital, amongst others. Eliminating the use of desflurane will improve our healthcare system's triple bottom line, which I like to refer to as patient, planet, and prosperity. Nitrous oxide is another potent greenhouse gas and anesthetic gas that our working group has been discussing recently. The main concerns with nitrous oxide are leakage from supply systems and its persistence in the environment. It will last in the atmosphere for more than 100 years. Addressing anesthetic gases is low-hanging fruit. Reducing our use of desflurane and wastage of nitrous oxide can reduce our carbon footprint and our healthcare system's climate impacts. Our second focus has been on what is referred to as the circular economy. Most people know this as the 3 Rs, or reduce, reuse, and recycle. Add to this rethink, redesign, and research, and other elements, and we can create a sustainable model for resource use. Ontario's anesthesiologists recently released a position statement on applying circular economy principles to the procurement and use of operating room supplies, highlighting the need to move away from single-use disposables to reusables and more sustainable practices. This is not new thinking, but it's become imperative in the face of a growing climate crisis. The principles are not unique to the OR and can be applied to supply use throughout the healthcare system and under other industries and institutions as well. The supply chain, or the stuff we use, accounts for the majority of healthcare's greenhouse gas emissions, about 2/3 by most estimations. Operating rooms themselves are very resource intensive and generate 20 to 33% of a hospital's total waste. Much of that waste consists of plastic products that are intended to be used only once and then discarded. In some cases, supplies are even discarded when not used because they're unwrapped. All of these products require energy to produce and generate GHGs when they are manufactured and shipped. They all contribute to healthcare's carbon footprint. Healthcare must move towards the circular use of resources, where devices and supplies are designed for reuse, they're maintained in a high quality state for as long as possible, and then they're refurbished or recycled, minimizing costs. A circular approach also reduces the potential for supply chain interruptions, which was a significant issue for us during the pandemic. There's excellent examples of circular resource use from the ORs, such as laryngeal mask airways, which are used to administer anesthesia. They're balloons which basically are placed in a patient's throat in which you breathe anesthetic gases through, and surgical gowns. In both cases, the environmental and financial costs have been shown to be lower with reusables, and yet most hospitals are using single-use disposable products. A circular model considers what are referred to as the life cycle costs of a product and takes into consideration the unaccounted for costs or externalities. We need to start looking at the bigger picture, including environmental costs of how we deliver healthcare. Ontario's anesthesiologists believe that we have a responsibility as professionals to lead by example and work within our institutions and with other organizations to transition our use of healthcare resources from an unstable linear model to a more sustainable circular one. We need to mitigate the impact of healthcare on our environment and in return the impact of climate change and environment on our health, and develop a culture of sustainability in our healthcare practices. We can continue to deliver high quality care while being part of the solution to addressing the climate crisis, which is the objective that we're trying to achieve with this position paper and with our work. Thanks very much, Dr. Park, and everyone for your attendance, and I appreciate this opportunity.
Thank you to our panel for sharing their expertise. We are now going to open up our Q&A session. The OMA's Emily English will moderate this portion of today's briefing. Please put your questions in the Q&A chat. If we don't get to your questions, the media team will follow up with you. You can also email media@oma.org with requests for interviews or information, and we will have a recording of this session available later this afternoon. Emily?
Thank you very much, and thank you to the panelists for those opening remarks. The first question is for Dr. David Ohrling. Can you elaborate more and tell us what kind of waste is left behind in an operating room after a surgery?
Sure, thanks, Emily. I started practicing about 30 years ago and have been giving anesthetics for about 25 years now. And when I first started practicing, virtually all the supplies that we used were reused. The surgical gowns, the surgical drapes, some of the airway equipment that we used was reused. We even had glass syringes to administer medications. Gradually over time, we've moved towards single-use disposables so that now our gowns and drapes are disposed of after cases. A lot of the surgical equipment, as surgeries become more advanced, is single-use and is disposed of after cases. A lot of tubing is made of polyvinyl chloride, which has a higher environmental impact when it's made and is disposed of after cases. And much of our airway equipment is all single use and disposed of. The list has been growing. Our hospital generates about 23 tons of waste a month. We're a small hospital. There's almost 400 hospitals in the province. All of this waste has an environmental impact in producing it, using it, shipping it, and disposing of it. And this practice really needs to change.
Thank you very much for that answer. And we have a question now for Dr. Adler Nevo. Doctor, could you tell us, as a physician and as the chair of the Greenest Health Medical Interest Group, what are some changes that you would like to see the healthcare industry make?
Yeah, so I'd like to stress, and you know, you see me nodding everything that Dr. Park and Dr. Ohrling had said. You know, I just support 100%. I think we have our role as physicians is twofold. We can decrease our own carbon footprint, but we can also serve as role model, because as exactly like Dr. Ohrling said, this can be duplicated everywhere. As the hospitals and if we were a country worldwide, we would have been the 5th largest emitter of greenhouse gases. And I think this happens because we're provided a lot of leeway because we take care of people and people's health is important. I think that what people don't know is that we can do the same job without any risk to people, with circular economy and without reusable products, without single-use products. So there are changes from small to large. When I work at Michael Garron Hospital, we do not have green bins in the hospital. I see that sometimes there are no garbage, and that means that people throw garbage into the recycling bins. These are just small examples of things that we can do every day. People print documents in order to sign and then scan them and send them, and they're kept electronically. Why we don't need to print those at all. So these are just examples of the small changes we can make. every day we make 30,000 decisions. And if we have those decisions in the back of our mind, in any little decision, we can make big changes in the hospitals and outside of them. There's many more things to say, but I think that I'd like to move on.
Thank you very much for that answer. We have a question now for OMA President Dr. Andrew Park. Beyond climate change, can you tell us about some of the other priorities that the OMA is working on in terms of improving the healthcare system now?
Yeah, absolutely. We have to look at the system in its entirety, and that's what our main focus has been through our prescription, and where we are with our progress report is a I guess like a midterm evaluation, as it were, or a report card of what we've accomplished and what we're still really looking to go forward with. Our three main priorities moving forward for this calendar year are to ensure that every Ontarian has a family doctor. Equity and access of care is something that is a big focus, and we have 2.3 million Ontarians without a family doctor, and that's 2.3 million too many. We're also quite focused on the administrative burden that is facing physicians, and how we can ensure that the job of being a doctor is to be the doctor as opposed to being in front of a computer. And lastly, we're focusing on home and community care to ensure that those that are the most vulnerable amongst us, particularly our frail elderly and our complex medical, receive the care that they need in their own home. So those are some of the key priorities we're working on currently.
Thank you very much. And we have another question for Dr. David Ohrling. How can hospitals reuse more items in operating rooms while still making sure that they're safe for patients?
Thanks, Emily. Yeah, certainly, one of the rationales for shifting to single-use products has been safety over time, or the argument that single-use products are safer to use, when that's actually never shown to be the case. And most people would be well aware that if you're having major surgery, the surgical instruments that are being used for those operations are all reused. We have experts in our hospitals who do medical device reprocessing and sterilization. They have the tools and the equipment to properly and safely reprocess equipment. And it's a matter of, as mentioned, the R's that we think about in a circular economy being expanded to include redesign and rethink, as well as research and how we look at products and put them into use and reuse. Ontario's Anesthesiologists is collaborating with a number of other organizations, including the Canadian Coalition for Green Healthcare and Cascades, along with group purchasing organizations and hospital procurement officers from some of the major hospitals like Hamilton Health Sciences, to discuss how we can include green thinking in RFPs for products, to push suppliers to design their products in a way that we can reuse them as opposed to dispose of them. Some of this work needs to come from a higher level. We need hospitals measuring their greenhouse gas emissions and having targets to try and reduce them, and have sustainability goals embedded in their strategic plans and in their policies, so that the entire system works in alignment to move away from single-use products to reusables. This can help us curb greenhouse gas emissions on many levels, not only with our supply use.
Thank you very much. And we have another question now for Dr. Adler Nevo. As a psychiatrist, can you expand on the term eco-anxiety and how you see it in your practice? And can you also tell us about the need for an eco-anxiety clinic in your hospital?
Yeah, thank you very much for that question, Emily. So eco-anxiety is a new term, which also, I think, demonstrates how important the climate crisis is. I work specifically with anxious children and youth, and most of my patients worry about the climate crisis, as I said. I think the term eco-anxiety is misleading, because when we talk about anxiety, we talk about a fear relating to something that is unrealistic or exaggerated. So only the person who feels anxiety has the anxiety diagnosis. But when we talk about eco-anxiety, the trigger is, although it's distant, somewhat distant, it is realistic because we have abundant evidence to support it. And so you see that there are people who feel this anxiety as I do, and I would call it fear, and they act, and that makes them feel better and makes them feel as if they have agency and can change. On the other hand, there are people who have pre-existing anxiety disorders, and they would need support in order to understand where is the anxiety that is on top of the fear that they can alleviate, the anxiety that paralyzes them, that they can receive help with and remain just with the healthy, functional anxiety that helps them support climate change work. In our clinic, we're starting to have a group for eco-anxiety that can help people who feel that dysfunctional anxiety, that paralyzing anxiety beyond the functional anxiety that we all feel.
Thank you very much for that question, for that answer. We have another question now for Dr. Andrew Park. This one comes from journalist Eric Stober. Have we seen more heat-related hospital admissions in June and July, given reports that they have been the hottest on record?
So typically with heat-related exposure, we have a rise in emergency department visits. I work as an emergency physician, and these typically go up. Our experience from the massive BC heat wave in 2021 demonstrated definitely a big rise in common illnesses like heat stroke, dehydration, acute kidney failure related to dehydration from the heat wave. So we definitely see it. And the other thing that I would say is that these aren't in isolation. Like these add pressure to an already burdened healthcare system where people still require their routine care for the the emergencies that are still arising, regardless of the heat exposure. So these add a layer of stress that we are experiencing on an already stressed system, and that's also important to remember.
Thank you very much. And another question now from journalist Eric Stober. This one's for Dr. David Ohrling. Can you go over exactly how the healthcare system contributes 5% of emissions in Canada?
Sure, thanks for the question. That number comes from studies that have been done looking at healthcare expenditures and extrapolating them to greenhouse gas emissions based on a number of variables and things. That number is fairly consistent worldwide. It's actually higher in the United States. The emissions that any institution produces can be broken down in what people call scope 1, scope 2, and scope 3 emissions. The use of supplies and things fall under what's called scope 3 emissions, which are the upstream and the downstream value chain added operations that an institution has. Scope 1 are direct operations, which would include the anesthetic gas use and other things. Scope 2 is energy use. But those numbers have been peer reviewed and studied, and they're valued. They're validated. I'm sorry. As mentioned, the amount of greenhouse gases that the healthcare industry produces is higher than the airline industry. It's substantial. We are in the business of improving people's health, and we shouldn't be worsening people's health by worsening the climate crisis. And I think that's the point that needs to be driven home. The number may seem small, but our role is big, and our role as leaders is even bigger. And we need to lead by example and address that.
Thank you very much. And we have a question now for Dr. Andrew Park. This one is from Marjo John. She's with the Medical Post. What should doctors be doing to help vulnerable patients, such as older Canadians, stay safe in the face of air quality issues, particularly ash and smoke?
Thanks for the question, Margot. any major environmental exposure for our patients can be damaging to their health especially when we're seeing the extremes of certainly heat, ash, smoke, and as I discussed earlier, these can certainly impact where irritants cause problems such as in your eyes, in your throat, in your lungs, on your skin. And so the most important thing for us as physicians is just to ask, to ensure that our patients have the resources to be able to withdraw themselves from the environmental exposure with indoor spaces that are cool and dry, or whether we're able to advocate for them to have family with them. Oftentimes we don't ask those questions, and those are really important to ensure that our patients both have the knowledge as well as the resources to remove themselves from some of these harmful exposures.
Thank you very much. And we have another question now for Dr. Adler Nevo. Do you expect the health impacts of wildfire smoke to increase in the coming years?
Absolutely. So if I might just add to the previous question, you can watch the Health Canada air quality index. And if it's very high, an ion 10, people, like you mentioned, the elderly and people who are at risk should stay at home and not go out. And if it's lower, then they can go out. That's just one addition. So clearly, I think there's, when we talk about studies and we talk about research, some of our research proves what is already intuitively known. So I think our intuition tells us that nature is good for mental health. As Canadians, and I immigrated to Canada from a different country, I can tell you that cottage country is the best ever. And my patients who are anxious, I try to ask them, where's your place where you feel calm, where you're not anxious? And a large percentage of people who are lucky enough to be able to be in cottage country tell me it's the cottage. So when you're in Canadian nature, you have no stress. And so that it's intuitive that when we're in nature and when, the sky is bright and there's good weather, our mental health is better. In the winter, people have more depression. So intuitively, nature is good for health. So of course, when, climate change is rapidly deteriorating nature and rapidly deteriorating our climate. And with that, like Dr. Park said, we cannot have healthy people on an unhealthy planet, and especially regarding mental health. And so we can so easily prevent that from happening. So thank you very much for that question.
Thank you. And another question for Dr. Park along those lines. Why is it important for the OMA and other healthcare organizations to pay attention to climate issues?
Yeah, I mean, it's a great question. I mean, the biggest reason is that we don't practice healthcare in a vacuum. I mean, what impacts our patients impacts the system, impacts us. And I think we have to be aware of those issues, whether it's equity and access, vulnerable populations, housing, because these have real health impacts for our patients. When the WHO says, when the World Health Organization says that this is the single largest threat to health, you have to take that seriously, and you have to understand what that means for our patients, what that means for our planet, and what we as physicians who are regarded as leaders in our community can do to advocate for a healthier planet, because we understand the impacts that has on our patients. I think it's important. We talk about really redefining what our system is and what it could be, and I think in the broader discussion of this is the idea of sustainability and what that means for future generations, both from a health system perspective and what works in healthcare, but also in what ensures that we have a healthy planet to do so.
Thank you very much for that answer. And another question for Dr. David Ohrling. How can we curb greenhouse gas emissions produced by hospitals?
Thanks, Emily. I think the first step is that we need to recognize and acknowledge the problem as a system. Certainly, as mentioned, it would be ideal that hospitals started to measure their greenhouse gas emissions and started to set targets to work to reduce them. We have tried to engage with Ontario Health, the Ontario Hospitals Association, and through anesthesia chiefs in the province, all institutions, to get them thinking about this issue. Ideally, hospitals themselves would have sustainability embedded in their strategic goals, support from senior leadership, and policies around sustainability and procurement that would help them to start to reduce their impacts. I'm very proud to say that my hospital in Collingwood has taken some of those steps. We have an environmental sustainability working group. Our senior leadership team has put in place a policy for sustainability. It's all on paper. We have work to do in making it actionable, but those are very important first steps. There is a number of other initiatives that could be taken as well, including education, getting sustainability embedded in residency programs and medical schools, so that future professionals as well would start to carry this work forward, which is very important. We really need it on all levels, is what we need to do if we're going to address this problem and curb our emissions.
Thank you very much. And we have a question from journalist Sable Sack. This one I'll direct to Dr. Andrew Park. Could you tell us about respirologists noticing decreased lung function among patients as a result of wildfire smoke exposure?
Yeah, absolutely. Thanks for the question. When you have a lower air quality index and there's increased particulate matter in the air, that impacts us. Our body is trained and is built to defend our sense of a threat. And certainly when you're getting these small particulates, again, in areas like your eyes, which have increased risk of allergic conjunctivitis or swelling of the eyes related to these particulates, your lungs are no different. And so getting these into your lung will cause an immune reaction, which your body's trying to defend you from, which creates a bit of inflammation in your lungs and can cause difficulty breathing, some shortness of breath, and that impairs your ability of your lungs to function at peak capacity. I referenced the BC heat wave. The other thing that we saw was a rise in admissions for pneumonia to hospitals. So these have broad-ranging impacts, all the way from decreased function all the way to increased infection and certainly some life-threatening complications.
Thank you very much. And another question for Dr. Adler Nevo. We've been talking a lot about the impact of higher temperatures and of the wildfires. Are there health impacts as well to colder temperatures or other weather events like floods? Could you speak to that?
So first, it's important, I think, to understand that climate change and the climate crisis creates extreme weather events. So it's like a yo-yo. I think the biggest problem is the uncertainty. We've been in our age, this time in history, we've been fortunate to live in constant, predictable climate. And just the fact that climate is no longer predictable, that we have hailstorms in the middle of summer, that we have very cold winters, very warm winters, that people cannot skate any longer in their backyards the way they've been doing for decades. That uncertainty is very unhealthy. Psychologically, it makes us all very anxious. And I think more important than extreme cold or extreme heat, the unpredictability is a problem. I come from a warm country, and from Israel, and people always say, how can you live in such a cold country? Because you have to be cooped up in your house and you can't go out into the cold. And I think it does affect people. It affects culture, always living in a cold climate. You know, there are extreme health risks to extreme cold and also extreme heat. We can talk about wet bulb temperature, for instance, which is really important more to people in the global south than to people in Canada, but there are so many things additional things to talk about. Thank you for that question.
Thank you very much. And a reminder to journalists, you can put questions in the chat. And if we don't get to them, you can follow us up. You can follow up with us via email, media@oma.org. I have another question for Dr. Andrew Park. Can you tell us about possible mounting pressures on the healthcare system if we see a rise in climate-related events in coming years?
Yeah, absolutely. So there's a couple of issues, I would say. The first is the immediate impact of whatever weather or climate related system, trend, disaster that we're seeing at any one given time. As I talked about, the heat impacts, air quality, smog, smoke. All of that can create the immediate impact, which, as I said earlier, does impact our health systems that are already under strain to begin with. So we're creating another layer of pressure to an already pressurized system. But on a longer term basis, I would also say that this, when we look at climate change and we look at the impacts of it, it doesn't impact all segments of our society equally. And certainly it impacts the most vulnerable. And when you're vulnerable in a system, whether it's from socioeconomic factors, medical factors such as multiple chronic conditions, lack of housing, lack of income, lack of education, and access to all of those things that determine our health, what happens is that the vulnerable continue to be pushed down as opposed to being propped up. And climate is another example of how that happens and creates a furthering of inequity in our population that makes it harder for people then to, again, access the basic institutions such as healthcare, which again has a bit of a cycling effect of causing further problems down the road. So this is why this is a very relevant conversation for us in healthcare to understand the implications of, and advocate for solutions and also be part of the solution, as Dr. Ohrling has done in his hospital, and we've seen examples of this across our province.
Thank you very much. And thank you to all the journalists who attended and of course our panelists. I'm going to hand it back over to Dr. Andrew Park with some closing remarks.
Yeah, I just want to thank everyone for attending today and for your thoughtful questions. As you've heard today, doctors want to see action to be taken on climate change to mitigate its severe consequences on health. And we've written this in our prescription for Ontario, which is our doctor's 5-point plan for better healthcare. Ontario's doctors will continue to advocate for solutions to strengthen our system and advocate for our patients' well-being. Thank you everyone for your time today.